Welcome everyone to the July 2026 MIDAS webinar. I'm Harry Hockheiser, Director of the Center, and today it's my pleasure to introduce Pilar Fernandez. Pilar is an assistant professor at Washington State University's Paul G. Allen School for Global Health. As we were discussing, that is not in Seattle, is in Eastern Washington on the other side of the state. And here in Pittsburgh, we definitely have a lot of sympathy for people who feel like they're on the neglected or under thought of side of the state. But Pilar is a disease ecologist whose research examines how human behavior, animal movement, and environmental change shape exposure to vector-borne and zoonotic diseases. Our work integrates spatial epidemiology, movement data, ecological field studies, mobile health tools, and mathematical modeling to improve disease surveillance and prevention through a One Health framework. And as I was just saying, we always hear about ticks here in Pennsylvania, and so it's definitely a concern of ours, both personally and professionally. And so looking forward to hear what Pilar can tell us about how human behavior interacts with tick-borne disease risk. So thank you, Pilar. We're looking forward to hearing your talk.
Thank you. So I'm going to go ahead and share my screen. Okay.
Looks great. Go ahead.
Perfect. Okay. So as Harry mentioned, I'm going to talk about how do we integrate human behavior into tick-borne disease risk assessment. So what is the role and how do we how does human behavior falls into the middle of translating the tick hazard into actually human disease. So to start with, there we go. Let me go. Is it going? No, there we go. Okay. So the approach that I use in my research, as full disclosure, I don't consider myself a modeler. I'm a disease ecologist, and I always work on the interface between integrating human behavioral sciences into traditional disease ecology, because we understand zoonotic disease transmission in particular as a complex system that includes not only ecological factors and biological factors, but it's also embedded in a cultural and political matrix, and it is affected by socioeconomic, cultural, and human dimension context. So the idea of this approach is to kind of integrate and see what emerging properties arise from the integration rather than studying them as separate components. So just to dive into what I mean by the integration and what do we mean by risk, I want to start by separating different concepts that usually are brought up together. A lot of people think that obviously, for example, when we talk about ticks, or it could be about other zoonotic hazards, we think that the more there are in the environment, the more likely people are going to get exposed to that. And so we can take that as a proxy for risk, which is true to one extent, but the reality is a lot more complex than that, because exposure to the hazard might be modified differently in time and space, and it's not always linear. But we also have another component, is how do people respond to that exposure? And that's where we talk about vulnerability, which is how people respond to the consequences of that exposure to the hazard. And it can be preemptive or it can be after the fact. So for example, if we talk about vaccinations, that could be something that lowers vulnerability to risk, and that's a preemptive measure. But we also can talk about healthcare access, which is given that people got exposed to, let's say, a tick, how likely is that they're going to be able to access healthcare and deal with the consequences of that exposure and infection. So by separating that, we can start studying the components a little bit separated, but again, try to understand how the different components, how risk arises from the different components as emerging properties. So when we talk about hazard, we usually study the geographic distribution. For example, when we talk about vectors or other reservoirs, what is the local abundance and behavior? What is the seasonal population infection dynamics in the long terms, and how it gets affected usually by environmental variables. When we talk about exposure, there's a lot of things that we can look into at different skills, but we can start understanding how, for example, human activities like land use practices affect exposure. We can include extreme weather here as a consequences of anthropogenic change. How do people live, act, and get exposed to that? And what is the infrastructure and housing conditions that might facilitate? And this is just some of the examples that can affect exposure. And again, when we talk about vulnerability, we talk about different aspects of vulnerability, and that it's not necessarily associated with socioeconomic status, but we can also talk about conflict and healthcare access, migrant populations. But we can also talk about susceptibility and immunity as another layer that can affect that vulnerability, food security and nutrition, of course. So taking that framework has been used for environmental risk assessments and environmental toxicants for a long time, and in the last decade has been adapted to zoonotic diseases. And what I'm trying to think about here, a little bit different in my research, is how do we translate this into different layers that can be combined to think about risk and be able to get it to true estimates of disease risk based on these different components. So if we think about tick-borne diseases, we have the tick hazard that can be honestly the important layer that without the layer, if you don't have ticks, then you're never going to get exposed to ticks, obviously, but that changes in space and time. And on top of that, you can think about how you can add a human behavioral landscape layer. And with that, we can talk about where are the areas that people use that where they can get exposed to ticks, where they use more frequently, but we can also include other aspects of how do people protect themselves. Do they protect themselves in certain areas more than others because of risk perception? And so all that can be embedded in a human behavioral landscape layer that interacts with the hazard layer. And then, as I mentioned, for example, you can add other measures of vulnerability. And so, for example, there's a social vulnerability index that has been developed in the US, but also we have access to another global layer that had been developed. And you can also create your own depending on which aspects and which populations you're working with. But that layer will also give you an idea of if we want to do estimates of Lyme disease incidence, for example, and it's undercounted. Can we include that layer to account for people that don't have access to healthcare and they don't get diagnosed? So here I'm gonna, in this talk a little bit more about how can we build that layer. But why do we care about how do humans get exposed? And I think for vector-borne diseases, this has been one of the key parameters that we always been that direct a lot of the disease dynamics, but we have really, for many systems, imperfect ways to measure that. So obviously, it's important to measure how humans, what's the rate by which humans get exposed to the pathogen, and that because it's a vector-borne disease, it is the binding rate between the vector and the human. What is the binding rate of the vector when it feeds on humans? Then it's gonna direct that. And as I mentioned, that is a really difficult way to measure empirically for many reasons. In particular, for tick-borne diseases, it's even more difficult because a lot of people miss the tick. There obviously in tick-borne diseases, we have all stages feed on mammals, or vertebrates, but the different And humans can get exposed to larvae, nymphs, and adults the same way. The reason why we associate nymphs as the main stage, which is the intermediate stage, is because larvae, when they feed and humans get exposed to larvae as well, they usually hatch from the egg and they're not infected when we talk about, for example, Lyme disease. And so the next stage, and they will take a blood meal on an infected reservoir, and then as a nymph, when they molt as a nymph and they look for a new blood meal as a nymph, a percent of them are going to be infected. And they're still small enough that people might miss them, but a proportion of them will be infected. And usually that the time of the year where they're active, which is in the spring and in early summer, it's where people are also most active outside. And so there are higher chances of encounter, but also they're small enough that people may not notice them. And the adults, yes, they can also transmit, but usually people tend to spot them easier because of their size. So there are different ways to measure human tick encounters. One of them is obviously empirically. We can ask people how many ticks they have encountered, but that, as I mentioned, it's really imperfect measure, and most people don't recall or don't even realize that they've been bitten by a tick. There is another possibility that has been in the discussions. We still don't have great tools to measure this, but another option is to measure past exposure using, for example, an ELISA that measures anti-tick antibodies. That is in the discussion. There are people working on this, and that would be a great tool to incorporate into epidemiological studies. But unfortunately, at the time, we don't have great tools to measure this. And we have tried to ask people, and this is going to come handy because then I'm going to talk about how we have used a smartphone application for measuring other aspects of tick-borne exposure. But we did develop a smartphone application that it's called the Tick App. And this is a combination between, we have the CDC Centers for Excellence on Vector-Borne Diseases in the Midwest and the Northeast. And this was something that started when I was a postdoc in 2018 and started in 2017, but we launched the app in 2018 to be able to collect community science data. And one of the things that it's embedded there is obviously we recruited people to provide it, to download the app and provide information about their daily environments. If they have found a tick on themselves, they can take pictures of the ticks, and we have an algorithm and people reviewing the algorithm to image classification that gives them back information if it's a tick or it's not a tick, or what type, what species it is. And we also have really short surveys where we ask where they have done that day, what type of outdoor activities, and if they have used any protective measures. And I'm going to come back to this later. But there's obviously a lot of challenges to understand human behavior links to tick encounters through citizen science. One is people don't necessarily remember. So if we were used to do this with traditional surveys, for example, epidemiological surveys, people tend to forget really easily or recall bias. And so that creates a lot of gaps in knowledge. We also, by doing traditional surveys, we lack precision of encounter location and the accuracy of tick species identification. Let's say if it's self-reported. A lot of people maybe confuse ticks with other insects or arthropods, and sometimes we need more precise information on what type of species, because not all tick species transmit the same diseases. So that's when we launched the Tick App, and it's based on this notion of ecological momentary assessments, which is basically repeated sampling of subjects, current behaviors and experiences in real time. And so by doing this, we recruited people. The app is open to everybody, but it also recruited people in certain locations to use the app for at least a week or 10 days to collect information on their daily activities. And as I mentioned, so what we ask for those participants is to every day, at the end of the day or at some part of the day, to answer one very, very short survey where we ask what activity they did today, if they use any protective measures, and if they found any ticks. And if they did find any ticks, they can open the app at any time and take a picture of it. And so with that, we also have access to a lot of contextual information. And because it's on the smartphone, we are able to use the GPS location capabilities of the phone to get accurate GPS data, which I'm also going to go back to that later because we have developed a pipeline to analyze that data to get more to the mobility patterns that people have related to tick exposure. And so with this app, we were able to reduce recall bias by doing real-time reporting, and the app has a lot of information as well. So it's feedback that people do get information back to them. And as I mentioned, we have the GPS location. And because we have an AI algorithm embedded for tick identification, we can give a quick response that is usually verified by someone in our team to increase the accuracy of the identification. But people do get feedback on that. So in a very basic study that we did at the beginning to kind of assess like the self-reported tick encounters, we found that, for example, for the dog tick, Dermacentor variabilis, it coincided that most of the people reported them encountering in grassy areas based on the GPS location. So we took the self-reported tick the self-reported tick data and the pictures submitted by the users, and we contrasted that with different layers of land views based on the GPS location. And for Ixodes scapularis, for example, we found that, which is the black-legged tick that transmits Lyme disease, we found that most of the users had been in forest, in kind of the within 2 days of the exposure. So using this information kind of give us some confidence that, well, at least some of the key environmental habitats had been, we were able to recover that. Again, it's still imperfect because it's still based on self-reported tick encounters and people missed a lot of ticks. So in the next one, we tried to estimate it integrating multiple data sources. So we took a different approach. And this is a study that we did in a very small scale in an urban park on Staten Island in New York, where we measured the tick hazard traditionally by using dragging to estimate the tick density. And if you don't know what that is, it's basically doing transects where we drag a piece of cloth 1 meter by 1 meter through the environment, and we assess we count obviously how many ticks we found, and then we do an estimate of tick density. So we did some modeling on the tick hazard to evaluate and have estimates of tick density in those parks. And then for the human behavioral landscape, what we wanted to see is, are people using the same environments where ticks have been found, or like the most ticky environments in a way, where most of the tick density was. And so we did 30 minutes observations to estimate exposure time. And that was done in different sections of the park. And those are the two components that we evaluate in this, and we try to integrate it. So this is an example. So we had a student basically sitting down and recording not only the location with mapping, which then we digitalize, but the location and the time spent in that location in a 30-minute period. So, for example, if we had one person doing exercise, represented in this case by someone doing yoga, and she spent 30 minutes there, then she only had that one location. And just to assess, because people are not just static in one point, we took the radius of 2 meters around them. But we also accounted for people moving within that 30-minute period, and we estimated how much time they spend in different parts of the tiki environment, so the park. So, for example, if they were in a pay path for 5 minutes and there are no ticks here, so no exposure, but then they move and they spend the rest of the time in sitting in, I don't know, next to a tree or in the grass, then we accounted for that. And our tick estimation, the tick hazard estimation, obviously took into account the different environments and the different land use covers within that really fine scale. So we had a layer that was really fine scale land use layer. But we also estimated where people were in, for example, in trails. So we have a person station at the entrance and at the end of the trails, and we kind of estimated how many people were coming in and out. And so we did estimates of like how long would they spend in that environment. And so with that, we estimated, we used passive sampling and we modified to estimate the possibility of tick encounter. And the idea of this is that ticks are not really going to move that far, and it's mostly based on the time that people spend in different environments. So the more time that they would spend, the higher likelihood that their tick is going to attach to them. So we took the probability of missing a tick has to do with the time in each focal point based on the total observation period. And we also included the tick density within 2 meter radius around the focal point. And so the probability of finding a tick is 1 minus the probability of missing the tick. So with that, we estimated for the different tick species that we have on Staten Island, and we did this study in 3 different parks. The one in the south, one in the southern point, one in the middle where we have usually highest tick densities, and one in the north, which has intermediate tick densities. And we found that, for example, Ixodes scapularis, most people get higher exposure in the southern park, even though the not necessarily have the highest tick density. And that was mostly consistent for Abrium americana, which is the another tick that causes, for example, the alpha gal, the meat allergy, and then for another new invasive species that we only found in the south. So consistently, Conference House, the one park in the south, had the highest, and that had to do with how the park is designed and where people spend time in that. But what's interesting is that there's a mismatch where most of the ticks are and where people actually finding the ticks. So this is an important evaluation of like not always tick density really is reflective of where the highest risk for humans are. But this is also a little bit imperfect, and it's really hard to extrapolate to other areas because each area has its own context. Again, for example, in the previous study, it really depends on the design of the park, so it's really hard to extrapolate broadly. So the other thing that we've been working on is how can we use mathematical models, especially simulation models, to study the dynamics of tick-borne diseases and how are people getting exposed to it by including human behavior and really assessing tick-borne disease cases or Lyme disease prevalence or incidence as an emerging property of the system. And if we think about it as ODE model, then We're interested again in the infected tick and susceptible human contact rates, so the bite rates. And for that, we decided to use agent-based models because it allows us to include some of the heterogeneity that we observe in human behavior. So, for example, we are able to incorporate parameters related to tick activity, so to human activity patterns. So, what type of activities are they doing when they are outdoors? Um, Not all the activities have the same risk. So, gardening, it's not going to have the same risk as riding your bicycle, for example. Mobility patterns, where are people going, how much they're actually spending time in risky environments, and if they use any personal protection measures, which is going to reduce the probability of finding a tick, or if they do get a tick, they will remove it quick or deal with it and quickly. And so that will reduce the chances of actually disease risk. So obviously there are different type of models that we can use. And as I mentioned, we decided to go for individual-based models to account for that heterogeneity. And so we can consider each human agent as going through these different states and having heterogeneity and having behavior depending, and they can have different type of behaviors as well. But they all can also have adaptive behaviors, which is what we usually see in humans, because depending on the ecological context, their risk perception, how are people getting exposed, or someone in their social network get exposed to them, then that will affect the risk perception and the probability that they're going to either use personal protective measures or avoid areas altogether. So this is our kind of general hypotheses for that model. And so we have what it happens in tick-borne diseases is that humans don't necessarily participate directly on the disease dynamic, or like the infection dynamics of the pathogen in the enzootic transmission cycle. Humans are usually dead ends that get exposed to, but usually we have an enzootic transmission cycle that happens in natural areas or parks and in peridomestic areas, and it is maintained by the main reservoirs, which are usually small mammals, and the tick populations are maintained usually by big mammals. For example, deer play a significant role. But this is what is going to generate the tick hazard that humans get exposed to. And so humans will get exposed to that based on their activity patterns and their personal protective measures. And that might prompt some actions to do interventions and to act on the enzootic transmission cycle. So there is kind of a couple natural human systems occurring where people might be getting the signal from the enzootic cycle, but also are able to act on it as well. And so in terms of those coupling processes acting out back on the enzootic transmission cycle, we identify local level interventions and household level interventions. We are working on those aspects as well, but in this presentation, I'm just focusing on the how individual behaviors might translate this hazard into actually disease risk. So just to remind you, this is kind of our structure. We are thinking tick hazard as the main layer, but then on top of that, we have the human behavioral landscape. And for now, I'm ignoring any vulnerability measures. And ABMs allow us to incorporate some spatial information. And so we started very simple with having just human agents and modeling the tick hazard as a raster layer. We are not including the dynamics of the tick population. We are working on a separate agent-based model that it's based on what is the host community compositions of non-human host community composition that affects the tick hazard, and we have plenty of work on that. But we decided to do a separate agent-based model where we simplified that hazard layer into just a raster layer, a spatial, basically an idea of like that's the environmental distress that people get subjected to. And so we started very simple with a toy model where the blue square represents a big park in an area embedded in a urban matrix. And this is basically because we were studying how ticks are, how tick risk is structured in more urban areas as opposed to like natural areas or very, very suburban areas. So our main matrix was a more urban area with parks. And then we based our data collection on Staten Island, which I'm going to talk a little bit more in a minute. And the red squares that you see here are those houses around the park that might have ticks in their yards. And so we have the human agents, again, blue is the park, the red squares are yard with ticks, and the other ones are impervious surfaces or yard with no ticks. And the agents are green or red, whether they're non-exposed to a tick or they exposed to a tick. In this toy model, they didn't have any activity patterns. They just did a random walk, and they didn't use any protective measures. And the agents were assigned to a house. They move an 8-hour time intervals. So like in the morning, in the afternoon. We didn't have weekends or weekdays. It's all together. And again, how people get exposed to ticks were if they go to a place where there is a probability of tick encounter, whether it's a park or a yard with ticks, they have a probability of tick encounter of 3%. And so we run the model for 90 days. And we assess a few counterfactual scenarios. So the first one, there was no adaptive behaviors. The second one, so that's our null model. And we compare 3 other scenarios where people avoided parks after being exposed to a tick. So that was their adaptive behavior. They found like, oh, I found a tick because I went to the park. So they started avoid going to the park, which according to our data that we collected through surveys has happened, especially in areas where newly endemic. And the third scenario is the use of personal protective measures to reduce. They don't eliminate the probability of tick encounter, but we decided that they will altogether reduce it by 50%. And the other scenario is people spraying yards with ticks. It's like, well, they, for some reason, thought they found the ticks most likely in their gardens as opposed to the parks. And so they sprayed them with ticks. They sprayed them to reduce the tick density, sorry. And so we evaluated the outcomes of the different scenarios. We measure human tick encounters and the average of people that spend in the different environments. And we found that all the adaptive behaviors, they do reduce the tick encounters in this toy model, and avoiding the park what had the highest. And it's probably because of how big the park was compared. So this is just to try to see if we could recover those signals. But because of that, we acknowledge that the distribution of the parks, where they are, but not only the amount of it, but how they're distributed will affect how people get exposed to it. We know that higher park density, for example, and fragmentation in the land will increase the zoonotic hazard and will increase the exposure risk at the edges. And we are considering like if there is lower fragmentation, and that's just our hypotheses, there is going to be less edge. And so the zoonotic hazard, which tend to occur at the edge more frequently, will be reduced because there's going to be less contact with the people to the edges, then that's going to reduce human exposure. And that has to do with the functional connectivity, not only for the host, that has been studied extensively with the dilution effect, but also how human movement is affected by the landscape and the characteristics of the landscape. So moving forward with that model, the next iteration was to assess the effect of the landscape configuration on the tick encounter rates. So again, ignoring the effects of the tick and landscape configuration on the tick hazard, but just looking at how likely are people, assuming that the tick hazard is constant in areas where we have some sort of green space, how are people actually encountering the ticks? So we did this, we simulated this landscapes based on a gradient of forest cover and a gradient of fragmentation based on a percolation matrix. So for example, we have different iterations, this is a landscape where we have 70% of habitat and we have a percolation probability that it's pretty high, so it's pretty aggregated, but again, you have 70% of parks. So it's mostly a green space matrix with some houses embedded in it, which is what you're gonna observe in a more suburban environment. And then I suppose I'm showing like another type of landscape where we have 10% habitat density. So this is more representative of a more urban area, where still you have a high percolation probability, where you have like tend to have bigger parks as opposed to small parks that can probably sustain a higher tick population. But again, ignoring the effects on the tick hazard, we're interested to see how likely is that people are going to move into this environments given this configuration. So what we found, not surprisingly, when we ran the model, is that the highest forest cover, the highest human tick contact rates. But when it comes to fragmentation, this is not unexpected to us. We were expecting to find a nonlinear relationship with fragmentation, and it's we can observe like a higher fragmentation, but not the highest fragmentation levels. We found the highest human tick exposure. What was interesting is when we did the interaction, the model actually had high deviance explained in the model with the interaction. And what we found is that a high forest fragmentation, where the forest fragments are small and they're very separated. Yes, more forest cover has a linear relationship with human tick contact rates. But at low forest fragmentation, this is not the case, where we found that forest cover, or the more park you have, increases human tick contact rates up to a point. And that is because at some point, the park becomes so big that people actually don't get exposed to like the center of the park, where you could still have ticks, but the actual, in a way, risky environment gets reduced because of how people move in the environment. So just to, again, those are just simulation. We didn't have any human mobility data, but we are trying to apply now this to our case study where we collected empirical data on human behavior from this location, which is the Staten Island. This is a newly endemic area where when we started working there in 2018, we've been working there for a long time now. It was a newly, the number of acquired cases locally had been increasing for the last decade, and that was associated with the increase in the deer population and the distribution of ticks in the parks. So we selected some focal parks, and around those parks, we recruited houses around them where we did tick dragging in the yards, but also we did collected information, human behavioral information by using the tick app. Again, we recruited people house by house where we tracked the ticks, and so we um, tried to recruit them for to use the app, and we did use some economic incentive to increase participation, and it was actually pretty successful. And then we also did a more extensive one-time survey to capture more knowledge, attitudes, and practice. And the idea of that is to get more contextual information about risk perception. What do people knew, and how did they value the risk? And so with that information here, I'm just going to focus on the data that we collected on the human mobility for now, because the idea is to focus on how are people getting exposed to it. We also, again, from the app, we have tick activity patterns. So we have the contextual information from the short-term surveys and the personal protective measures. But starting with the human mobility data, we collected, for example, GPS locations from person one. You can see the trajectories, and we have demographic information, and we are able to measure like the distance in the weekend, in the weekday, how much they spend in the forest as opposed to built environment when we use other land use metrics, for example. And then now we are trying to do some parameter estimations to be able to incorporate those movements into our model. And for that, we're using, we built a pipeline. We tried two different algorithms, did two different approaches, which one is STDV scan, which basically separates the GPS locations into the stops, and we can associate and analyze where are the cluster of points in space and time. And this allows us to kind of understand where are the significant places. We also use the STKW segmentation, and which is mostly based on change. So it's more of what is how do they when they change trajectories, and give us a little bit more information. And other inputs that we use is land covered classes, green space visit, stop duration, trip distance, movement states. And so we are currently working. I thought I was going to be, by the time I did this presentation, I thought I was going to be a little bit farther along, so I wanted to show more of this results, but I show some preliminary results now. But we build a pipeline to get the GPS data clean from the app. We use this algorithms to detect the stops, and we associate it with different parameters. We estimate the segment movement, just because we have gaps in the information. This is using GPS data from the phone, and so we don't have the 5-minute GPS interval, or it is variable in duration, actually, we found, and I'm happy to talk about difference between iPhones and Androids and what are the challenges that we have had, but this is real data from phones as opposed to like just a GPS tracker. And so we have a lot of limitations that we have to think about how to deal with it. And then we classify and summarize the moving, non-moving segments, where they are, the distance and time between weekday and weekends, and the time spent in different type of environments. So the first algorithm supplies exposure to relevant places, risky environments, and the other algorithm supplies movement dynamics between those places. So how far do they travel? Are people exposed, people that are living next to the parks, or are people coming on weekends from other places and getting exposed in those parks? So that is really important information to really see who is at risk, and not only how many ticks we have, but also how are people getting exposed to those ticks to really assess the tick density. So in our GPS data, we have pretty good representation of both genders. We were able to, through our recruitment and using some economic incentives, we were able to do follow-ups for usually about a week. But what was really surprising is some people that did it for a week, they kept doing it without really any prompt. And so we have really rich data sets of people that kept using the app for a month or until the end of that season. So these are examples of the distribution. We have the total distance travels, how much they travel weekdays and on weekends, and obviously you have outliers. So those are where we're interested in when it comes to the heterogeneity of the movement in our agents. So these are some graphical representations of where people are spending times and how that overlaps with the parks that are marked in red. And we found that among our users, 50% of the users visited green spaces, but only 3% of the time. So for us, that really means that this visit, people are potentially getting environmental exposure, but it's rather episodic as opposed to like a regular daily occurrence, which is also important for how do we message this and what does it mean. And obviously people spend most of the time in impervious surface, and especially in this area, which is more urban. And the last thing I wanted to mention is, of course, we're interested on how the exposure to ticks are affected by activities and preventions, and how do people think about it, and how do they inform that to us. So what was interesting is, remember that we use a one-time survey, and then we use the daily surveys that they have in the app. In the one-time survey, we asked in the last spring and summer, because we did this at the beginning of the spring, which of this tick preventions did you use? If you check for ticks, did you use repellent? All the things. And this is obviously, most of the people said they check for ticks, that they use repellent. But what's interesting, when we actually get that information from the daily log and we adjust it for only the ones that have been doing outdoor activities that day, we found that, yes, most of the people, at least they said they check for ticks, so that is consistent. But for example, repellent really fell to one of the bottom. They only 20% of the people really use repellent. As opposed to when we use the one-time survey. And none went from the bottom to maybe a little bit higher up. So that kind of gives us an idea of how this more contextual information can be useful, as opposed to like the traditional epidemiological surveys. So we're now basically trying to work on integrating these two components. And also we have information of what type of activity, not only if they've been to the parks, but what type of activities. So we're currently working on finalizing a paper where we summarize our pipeline for analyzing the GPS data based on the tick-up data. And then the next step will be to integrate all this contextual information into our agent-based model and explore some aspects related to adaptive behaviors. But the idea is that we understand disease risk as an emerging property, as opposed to just a proxy of the tick hazard. So with that, thank you so much, and I'm happy to answer any questions.
Thank you. Very nice talk. We have time for a few questions. Please raise your hand or put something in the chat. I have one question already from David. David, do you want to unmute and just ask your question? Let's see, I think I can unmute you. David, go ahead, please. David? David, you can speak up anytime you want.
Can you hear me?
Yes, go ahead, please.
Hello. Oh, yes. Thank you. Interesting take on behavioral risk factor. My question is about tick infection biology. Does it render any immunity, or after being exposed, you're still at the same risk? Are there any vaccines? I'm just curious.
Yeah, so in terms of there's one aspect which is the immunological response from the tick bite, which is one aspect, and then to the pathogen. So yes, there is an immunological signal or a response that is generated from a tick bite. That's what we're trying to leverage to kind of develop those ELISA assays to measure past risk tick exposure. That is short-lived. Well, we don't know, and that's kind of the challenge. There are vaccines not for humans, but for animals that are directed to the tick saliva proteins to be able to prevent tick bites. And instead of like doing a vaccine for each tick-borne pathogen, just to do for the bite tick species. So that is one aspect of it. For humans, there's no vaccine, anti-tick vaccine. For animals, there are some in the works. And for the pathogens, there used to be a Lyme disease vaccine that for a class action in the 2000s that was discontinued. There are efforts to bring back other Lyme disease vaccines, but I'm not aware for any other tick-borne pathogens. But again, for example, black-legged ticks can transmit multiple infections, not just Lyme disease. It can be Powassan virus, it can be babesiosis, it can be anaplasmosis, and even some within the same tick. And so I think we're still very behind on that. And there are other barriers related to how humans perceive vaccines that have been a challenge.
Okay, thank you. I understand. So there's a whole variety of pathogens carried by ticks. Thank you.
I have another question here from Marshall. Go ahead, please.
Yes, thank you. Can you hear me?
Yes.
Yes.
Yeah, thank you, Pilar. Very, very good presentation. I just have a general question related to the inclusion of behavior, human behavior on tick behavior into your model, but focusing more on the human behavior side. Do you think that if you're able to get perfect data, whatever that means, that are increasing the accuracy of human behavior into your model can substantially increase the predictive ability of this type of model? And on the same vein, based on your experience, do you think that any kind of realistic change in human behavior can alter the course of the spread of such a disease within the population, like, for example, in the US? Thank you.
Yeah, in terms of like the perfect data, I think that's one of the things that I gave up on that a long time ago. Especially when it comes to human behavioral. I think it's one of the discussions that I always have with. So I do a lot of field work and I do a lot of community engagement research as well. And so getting that context and understanding how hard it is to get certain parameters, it's been really key in my research. And that's the general discussion that I always have with modelers is like, yes, that's a parameter, the key parameter, it's impossible. But it's not that it's impossible to get data, is that data changes quickly. It's very contextual. And we have to be, how can I say it? Very flexible when it comes to understanding what does this data means and the how can we extrapolate that. So, for example, during COVID-19, this app started in 2018, and we keep collecting data. And we analyze how this behaviors change, outdoor behaviors change during COVID that had nothing to do with tick-borne diseases, but had an impact on tick-borne diseases. That's another paper that there's a preprint out there, but we just haven't published the full paper yet. But that changed with the context, right? And that was completely external to tick-borne diseases. And then I forgot the second part of your question, sorry.
Was related to human behavior. I mean, just say
Oh,
if we have a clear understanding of how human behavior contributes to the spread, do you think that this is a kind of setting where any type of behavior change might have a significant impact, or the best we can do is just to understand how behavior contributes to the spread?
Yeah, and that's the other aspect that I try to mention. One of the things that we want to understand with these models is the adaptive behavior, the human adaptive behavior, how that changes with risk perception. So we have another line of research to understand how these behaviors are related to risk perception and how that changes with the epidemiological context. So we have another paper that I didn't mention here, where we did measures of knowledge as a latent variable that we derived from our surveys. And we measure it in two different areas. One, hyperendemic. Block Island, if you know, in Rhode Island, it's hyperendemic. People have been living with ticks for 30 years, many cases. And Staten Island, which I mentioned, is a newly endemic area, and how knowledge and risk perception affected the adoption of preventative behaviors, for example. And we saw fatigue, basically exposure fatigue in the hyperendemic area that we didn't observe in the newly endemic area. And that will definitely change the trajectory of tick-borne diseases. Because if you think about intuitively, people that they hear about a lot of cases around them, they start protecting themselves, but after a while, when they're surrounded by it, let's say hyperendemic area, people get tired. And we saw that in COVID. And so even though they're aware of the risk, they might use preventative measures in a more selective way, or maybe stop altogether, and that will kind of increase the cases again of tick-borne diseases. So there is a dynamic related to how humans perceive risk, what measures they use, and how they avoid areas or not, related to how they think about the risk around themselves.
Thank you so much. I was asking that because you see similar thing with malaria. So thank you.
Yeah.
We have a couple of other questions here. It is the top of the hour. Do you have a minute or two more, Pilar?
Yeah, I do have time.
Great. So there's a question here. The question about looking at, I may have missed it, but have you looked at incorporating mobile phone data for mobility purposes?
Yeah, so this is, you're talking about not the GPS location from the phone, but actual, the what is it called? Yeah, the mobile data from the towers. So there's challenges with that. The reason we decided to do an app, I mean, there are a lot of data sets out there that kind of talk. Now they're selling even GPS points, like Veriset, for example, that you can acquire for different areas. That basically what they do is the same we have done with the Tick app. They buy from different apps that collect GPS data, and they give you, but basically for an area, the GPS location, and then you have to sort it out. We wanted to have this with the smartphone application to collect our own GPS data, because we wanted to be able to tie each user to more contextual information and not just get the GPS location. I think that when you get a lot of GPS location without context, you might lose other sources of information. And this is the only reason. I don't, not saying that basically the pipeline that we built for our GPS data can be applied to other data sets. And for other sources of location based on the antennas and the towers and all that, I haven't personally used any of that. But it's the same problem, is that we lose a lot of the specifics and um, the fine scale information that we wanted for the study.
Okay, great, thank you. Then there's one more question. How is the tick population size estimated when you apply this framework?
So yeah, so depending on on Staten Island, for example, so in the model for now, we kind of ignore and everything has the same tick density. If it was a green space, a risky location, it had the same probability. We assign a 3% probability of tick encounter. That was based on what it worked for the model to adjust other parameters, but also it is not unrealistic based on other estimations of self-reported tick encounters. But we have other efforts. So on Staten Island, for example, once we kind of figured out the human, how to incorporate this human behavior into the model, on Staten Island, we have been dragging for ticks, again, transects, where we collected tick information. And so we applied environmental models to estimate tick density in these different parks based on the different habitats. And more broadly, we have done also based that on, we have another project now that we have extrapolated to Long Island in New York, so like a higher extension. And we're using also the connectivity between the parks as another measure to estimate the tick hazard, because we know that deer are moving the ticks between the parks. And so we found that doing estimates of tick hazard based on animal movement, it's also a key aspect. And we should have a paper on that coming out soon.
Great, thank you. All right, well, since we're over, I'm going to wrap up. I want to say, as somebody who lives right in between two large urban parks where we have tons of deer that wander around and sometimes get into my neighborhood, I appreciate this talk and think about that risk all the time as I go through my walks and my runs in the park. So thank you for a very nice talk, Pilar. Just to confirm, we're going to put this up on YouTube if that's okay with you.
Yeah, that's okay.
Great. And we really appreciate the talk and good luck with the work. Thanks all for attending. We're going to take the month off in August, but we'll be back in September with the next MIDAS webinar. Please be on the lookout for the announcement. Take care, everybody.
Thank you.
Thank you.